Yeah, thank you so much. I'll be sharing work that was done in 5 different countries within Africa. So to begin with, this is an aerial photograph that was taken from Kampala, Uganda. And if you notice, there's a very big difference in socio-economic status by just looking at the map. And one of the pioneers of the social determinants of health, Professor Michael Marmot, once said that, for example, if you walk across one street to another in London, it's like you walked through almost a difference in 1 or 2 in life. I mean, it's like you walked through a difference of 1 or 2 decades in life expectancy. So it shows that things such as social determinants, the social determinants of health are very key in determining access to healthcare. So in this study, we wanted to find out the major differences in coverage of cervical cancer screening amongst different populations of women living with HIV. So to begin with, cervical cancer is still a very big burden in particularly low and middle income countries. And in populations of women living with HIV, it has been shown that there's a higher risk of development of cervical cancer in the people living with HIV compared to those not living with HIV. And there are already existing efficacious screening methods that are currently available to screen women. And currently there are lots of strategies, for example, by the World Health Organization. There's one commonly known as the global strategy to eliminate cervical cancer as a public health burden. And the major aim is to reduce the incidence of cervical cancer to as low as 4 per 100,000 by 2030. In one of these targets, there is common what is known as the 90-70-90 strategy. And the figure 70 is focused on screening. It aims to ensure that at least 70% of the women are screened with a high-performance HIV test by age of 35 years, and again by the age of 45 years. And all these targets have to be achieved by 2030. That's about 6 years from now. So in this study, we basically access data from the Demographic and Health Survey. This is a program that is mostly run by USAID in partnership with different ministries of health within Africa and outside Africa. And over 50 years, they've conducted about 400 surveys. It's unfortunate to note that very few of these surveys actually test women for HIV and also ask them whether they have screened for cervical cancer. So in the setting of Africa, there are only 5 countries that did that over that period. So in this study, we included surveys that were conducted from 2010 to 2019. And the population was women living with HIV and those not living with HIV aged from 25 years to 49 years. We took 25 years because World Health Organization recommends that women living with HIV should be screened at least starting from the age of 25 years. In total, we included 2,950 women living with HIV, as well as other women who are not living with HIV. And this figure basically highlights access to healthcare over the past 1 year prior to the survey. And from this, in summary, it shows that women living with HIV actually accessing healthcare more than people not living with HIV. As we know, women living with HIV always have to visit clinics to get medical refills or access various services. So this is something that can be actually targeted because it's an injustice to see a woman come and see you a couple of times a year over a decade, and then you realize that maybe 10 years later, they are diagnosed with advanced disease, yet yes, they are seeing a healthcare professional more frequently than the general population. So this is really something that we need to consider as we see these women as they come to the clinics. This figure shows knowledge about or having heard about cervical cancer. It compares the general population that's not living with HIV as well as the population that's living with HIV. From this, we see that on average across all the countries, generally women living with HIV had a higher proportion of women living with HIV had ever heard about cervical cancer screening compared to those not living with HIV. So that means that there's some great work that is being done in HIV clinics to ensure that women are being educated about cervical cancer as well as cervical cancer screening. But still, we see that this is quite low and needs to be addressed. In terms of coverage of cervical cancer screening, generally, if you compare both populations, in the general population, there is a low coverage of cervical cancer screening, irrespective of the method that is being used in that population. But it's good to note that amid this low level of coverage, there is a higher level of coverage among women living with HIV. And this is in the context of a population, because these surveys are conducted in the general population. But if maybe you sampled out a clinic that focuses on providing HIV services, when you ask women about whether they have access to cervical cancer screening, you might find a higher coverage of screening because most of these clinics are already implementing this. But when you look at the general population level, the coverage is still quite low. So this means that we really need to innovate strategies on how we can reach out to both women living with HIV and those not living with HIV to ensure that they access cervical cancer screening services. So in terms of the various disparities in access to cervical cancer screening, we looked at wealth quintile. Wealth quintile is broken down into 5. So we have ranging from the poorest wealth quintile to the richest wealth quintile. So in summary, across all these countries, the 5 countries, and across both women living with HIV and those not living with HIV, still we see that those in the poorest wealth quintile have poorer access to cervical cancer screening. When you compare those living in urban and rural areas, still we see that across the 2 groups, there's generally a lower access to cervical cancer screening among those living in rural areas. So if for example, you compare these disparities by place of residence and wealth quintile, it could come down to the fact that people generally of a lower socio-economic status usually live in neighborhoods that have limited access to healthcare, and of course, cervical cancer screening is no exception to this. In terms of education level, still across all the different countries, irrespective of whether someone is living with HIV or not, there's still a lower coverage of cervical cancer screening among those with no formal education. So also this needs to be addressed. How do I go back? Back again? 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 So in terms of, I'd explain this about education level. So in terms of marital status, we looked at 3 different categories of marital status. So we have those who have never been in union or ever lived with a man or are single. That was one category. Then we had those who are in union or living with a man. And then those who have been previously in union, that is, those who are divorced or widowed or separated. So when you compare this, generally those who have never been in union or are single tend to have lower coverage of cervical cancer screening. This could stem from the fact that maybe they see themselves at a limited risk or at a lower risk of getting exposure to HPV that could lead them to developing cervical cancer. So this slide basically is a slide that shows, it's a measure of socioeconomic inequalities that looks at what we call the concentration index and slope index of inequality. And all these indices basically tend to show you whether there is either a pro-rich or a pro-poor kind of inequality. And positive values usually tend to show that there's more of a pro-rich kind of inequality in access to cervical cancer screening. So in all this, we see that in all the countries, apart from in Cameroon, there is a significant pro-rich access, pro-rich inequality in access to cervical cancer screening. So it means that people who are living in urban areas, those who are in the richest wealth quintile, are more likely to access these services compared to those who are living in the poorest wealth quintiles. So in summary, we see that there is a low coverage of cervical cancer screening among the general population, although it is quite higher among women living with HIV, but still we need to improve it to reach the WHO targets of at least 70% of the women being screened by the age of 35 and again by the age of 45. And from this, there are several interventions that can be done. For example, implementing national cancer control plans and programs that were not existing in majority of these countries at the time of the survey, but currently most of these countries in the process of implementing them. Then also, there are easier tests that can be implemented. For example, there has been studies that have showed that there is a high acceptability of self-sampling for HPV DNA testing among various communities across Africa. So this is something that can be leveraged. And also integration of these screening programs in HIV clinics. And also doing studies in line with implementation science could also be something very critical, because we know that screening is very efficacious in identifying women with precancerous lesions. So why isn't it reaching its potential? So some of the things, for example, coverage is low. So how can we improve the coverage? And implementing or conducting implementation studies are something that can also be looked at. Yeah, thank you so much.